The March of Dimes has been working hard for children's health for many years. In fact, 2018 marks the 80th anniversary of the founding of the March of Dimes by President Franklin Delano Roosevelt. As you probably know, in 1938, our organization was originally founded to raise money to fund research to find a cure for polio, and we were called the National Foundation for Infantile Paralysis. In those days, everyone was desperately afraid of contracting polio. Very little was understood about the disease. How did a person get polio? Was it through the water supply? Did it travel through the air? Why did some people in a community contract polio and others did not? And most of all, how could polio be prevented? President Roosevelt launched a campaign to raise money to support polio research. He asked men, women, and children everywhere to send their dimes to the White House. His friend, radio comedian Eddie Cantor, aired a radio campaign saying, "It'll be like a march of dimes to the White House." Because of the thousands of people sending in their dimes, our foundation was able to fund researchers, including Dr. Jonas Salk and Dr. Albert Sabin. By 1955, Dr. Salk had developed and tested a vaccine to help prevent children from contracting polio. Once proven to be safe and effective, use of the vaccine quickly became widespread. That's when the March of Dimes sprang to action in another way, by supporting vaccination drives to ensure every child was immunized. March of Dimes also supported treatment centers, where anyone affected by polio could receive care, regardless of their race or ability to pay, which at that time was remarkable. As the vaccines became common and the number of people stricken by polio plummeted, the March of Dimes moved forward, and in 1958 announced a new mission focus: to improve the health of babies by preventing birth defects and infant mortality. In 1979, our name was officially changed to the March of Dimes Birth Defects Foundation. To learn more about that and more, watch our next video in this training series.